Palmer, Morticia, hello there. Tessa de la Rosa, Kio Marie, Megster, Kiss Kiss, hello everybody. How are my people on Facebook? Are you guys zooming in there? Hey, Pinky Defense, Nanny Alita, welcome. Oxora Enafates, I think. Ginger Girls 18, hello everybody. Welcome. Kedox, Lady in Purple, good to see you. Keo Marie Sand, and that's Kimberly there. And Rocky Marcus, Nurse Nettie. Hi, Nurse Nettie, 2020. Hello, Miss Puffer. How are you on the Facebook and YouTube? Good to see you, my dear. Oh, that's Nurse Nettie. And there's Matisha, good. Hi back at you. Welcome, everybody. This week, our discussion is going to be your discussion. So, hi, Concrete Sunflower. Hey, good to see you. I have a question. With my PGT results come back? I have a question. Will my PGT results come back on the patient portal? I don't know the answer to that. So, all those people who know if your PGT results come back on the portal, please answer that question. Hello, Heather. Question, is letrozole okay for people with low AMH? Yes. Letrozole stimulates your body to produce more follicle-stimulating hormone, which in turn will stimulate more eggs to be mature. So is it the best? No, but you know what? We do one thing at a time. Hey, Melissa, 25 weeks pregnant. And it's a girl. Congratulations. Our pleasure. Nicole Campbell, do you all accept the Viva grant? Don't know what that is. You might call our financial group, Nicole. I don't know what the VIVA grant is, but call financial. That's all you have to do, the 800 number. Hello, Kiki and Mirandari. Thanks for the kisses. Danny, Ninera 27. Hey, ha, hey, joined. Hey, Christy O'Neill, good to see you again. It's nice for you to be here. Do we do Robinson? It says on Jeanette Robinson, do you guys do saline sonos or HSGs at Colorado? Absolutely. Lauren, did I have a great Labor Day? I actually had a great Labor Day. My wife and I went to the Colorado Springs Zoo, and oh my God, it was fantastic. They had baby hippos, they had baby lemurs, there was babies everywhere. And then, of course, everybody was out with their babies. So it was a very family-oriented day, and it was beautiful. Walked around for 4 hours. It was great. Okay, what are the best option treatments for people with low AMH, Alma? Is I think going to IVF is probably your best route, regardless of age. If you have low ovarian reserve, that's what low AMH is. Hello, Caroline and the Phi couple, the Thiefy couple. Okay. Heather, does Omnitrope help me produce mature eggs? No. What is the maximum time I can take Omnitrope? There's no maximum, and low-dose naltrexone, you'll have to really talk to the nurses about the time with regards to pregnancy. We had a retrieval Saturday, 20 retrieved, 14 mature, 11 fertilized. God dang. I was told today we have 14, so is it possible all are fertilized now? Yes, because they do follow up when they're doing the checks. Remember, we only check a very specific point in time for fertilization, but we never throw anything away, right? So we check, and then we go back and check again, and yes, you can get more fertilized if you look at it a second day. We don't want to look at them a lot because the embryos shouldn't be looked at a lot. Val in the morning, is there any chance my estradiol to drop enough for a fresh transfer? No. If you already have hyperstimulation, meaning an estradiol over 3,000, it doesn't matter if it goes down. It's telling us we have a problem. So even if it were to go down, it's not going to change the risk. Okay. Okay, Vanessa, you're fantastic. Thank you. CNY Fertility Support Group. Guys, help each other. Does anybody have what was the question that I was going to ask the group? Yeah. Does anybody on here who's gotten their PGT results, do they get that on the portal? Does CNY somehow get that information to you on the portal? So if you know the answer, I'll say it out loud. Ginger Girl, 18, retrieval in the morning with me. Well, definitely say hi then, okay? Forever HK and kiss hug, Sarah, kiss hug. Nice for you to join us. Okay, can high CA125 caused by benign tumor cause miscarriage? Not likely. It's only a marker. It's like a gas gauge. It's a marker. It's not something that it does to you. Not that I know of. I've never seen that related. What add-ons for FET do you recommend for women with adenomyosis? Well, adenomyosis is endometriosis in the muscle. So if it's in the muscle, then things you can do in preparation for your cycle is Lupron. So maybe a month or two of Lupron or Alyssa. Low AMH and ovaries not responding to medicine. You have to ask me a question. Embryology receives the results from Cooper and contacts the client directly. There you go. Embryology receives the results from Cooper and so Kelly, thank you, Kelly, for telling us that. So whoever asked the question, that do they go on the portal? No, you're contacted by our staff. All right, first fresh transfer ended in a loss at 6 weeks. I'm on immune protocol 2. Should I go to immune protocol 3 for my FET or keep the same protocol since implantation was successful? Well, if you've had more than one miscarriage, like say you've had 2 or 3 miscarriages, then you might want to have a discussion with your doc. What can I take to help produce mature eggs? Well, Heather, an additional day of stimulation. So lower protocol. I'm not speaking English here. A low, slow protocol or adding a day or 2 may improve the number of mature eggs that you get. I've had my transfer of 2 4AA embryos on last Tuesday. My post-progesterone lab was 23. Is that good? Yes, that's very good. Itzy, if you have ovarian failure and don't have a period, is IVF my best choice? Well, that's a hard question. If you have ovarian failure, it means there's no eggs. Now, there may be eggs, but the terminology means no eggs. So yes, IVF in the form of donor egg would be the best. Or you can attempt your own eggs and then do what we call the donor egg backup. That's something that we do quite a bit for folks who just want to give themselves a try. What is your opinion on ovaries not responding to medication? Does that mean I should stop, Nanny? Well, it depends on how hard and how much medicine and how often this has happened. But the time to stop is really the time for you decide that. So Isabel and Vanessa are all telling us to join the CNY Fertility Support Group because we know you're talking about us, so you might as well talk together about us. Anyway, what are your thoughts of having a successful pregnancy after having a UFE, uterine fibroid embolization? I'm going to guess at that one. There are some risks associated with it, and there are some pregnancies associated with it. So if that's your circumstance, then you can try. What are your options for people with egg quality issues and no other diagnosis? Avoiding alcohol, tobacco, street drugs, and men avoid hot tubs. Smoking of any kind in either partner will affect egg quality. Alcohol in either partner, marijuana, either partner is going to affect egg quality. Acupuncture, adding growth hormone, Serovital. Okay. Hello, Dr. Greetings from Cleveland. Hello, Dorina Trinidad. Today was my second baseline and my transfer will be on Monday. My lining was today at 14. Is that good? That's excellent. Do the natural vitamins like Conceive Plus work? Well, the way they work, Brandon and Linda, is they fill in for the things that your diet doesn't have. Marisette, I had my transfer last Saturday. Any suggestions on medications? Well, Mara said, get on the phone, talk to the nurses. You should be on a stack of medications. Out of curiosity, what is the highest number of multiples you have seen during your years as a fertility doctor? Well, certainly quintuplets. I've not personally seen octuplets, but I've seen quintuplets. Is anti-mullerian hormone, that's, by the way, 20 years ago. Is anti-mullerian hormone at 4.7 good? It's very good, Luna. Christy O'Neill, with a difficult partner smoking and drinking, when should he, with a difficult partner smoking and drinking, when should he completely stop before retrieval? 3 months. Josie, I had a previous chemical pregnancy from IUI, no other miscarriage. Oh, I forgot the question. Jordan, what are your thoughts on going right back into another cycle after a failed first FET? We call those back-to-back cycles, and I think that they're well worth doing for retrievals. But when it comes to transfers, you may want to have another careful look as to why the transfer failed. I don't have any insight onto low-dose naltrexone. Is high LH in late luteal phase indicative of ovarian failure in PCOS if PCOS is not present? I would look at your AMH. Hey, 1A. Okay. At what point or with what diagnosis do you suggest IVIG? Well, Amber, I'm not I don't have, how do I put this? I tend to follow the American Society for Reproductive Medicine's guidelines, and the issue of IVIG is it's still considered quite controversial, so I don't have really a strong point of it. If you've had proven antiphospholipid antibodies and have significant recurrent pregnancy loss that's not explained by doing IVF with PGTA, then yeah, you might want to consider IVIGs. No tubes, low AMH, one ovary. What's the best suggestion? IVF as soon as possible, Mira. Sarah, losing weight will that improve pregnancy rates? Yes, if your BMI is over 30. Maricela, I'm supposed to go into my OBG for an endometrial biopsy tomorrow, but I just started my cycle today. No, you shouldn't be going in with bleeding. Is there any difference in results between Menopur and HCG-LH being used in stims? No, they tend to be interchangeable. Of course, the HCG-LH is less expensive. What is the percentage of success without trilamina lining? Nobody would do that study, Natalie. Oh, good. Amber, we'll see you in next month. Retrieval number 3. Emily, is Lupron or Orilissa necessary for someone with endometriosis? I heard of it often being used, but it's not part of it. I had the excision surgery in January, gearing up for my first retrieval starting next week, wondering if I should do Lupron before FET. Talk to your doc, but I think that's a good idea. I had to renew my MMR vaccine this past Friday, get on metformin and a low dose of thyroid regulator. Should I be good to go for a retrieval in October? Yes, you should be. Is it safe to use HCG for weight loss within 3 months of IVF? That's a long story. Yes, it's safe, but there's a lot more to it. So get a consult, and I know a lot about HCG dieting. So if you want to get a consult, you certainly may with me. What happens if retrieval will fall on Sunday? We do not do retrievals on Sunday. It's either done on Saturday or Monday. So a day before or a day after. Is Menopur better than HCG with gonal F? No, Lisa. Thanks for adding omotropin to our protocol. We got 18 eggs in our retrieval today. Woo, woo. Last time we only had 13. You're welcome. I just found out this is Alyssa. I'm heterozygous for the MTHFR. I am heterozygous for the MTHFR gene defect. Should I have more intense FET protocol? No. What you should do is add additional folic acid. Pause by poor connection. I don't know why that is. Sorry about it, Instagram people. Don't know why there's a great connection here, but sorry on the Instagram side. Hopefully they'll come back here. For a 40-plus-year-old, there they are. Hello. For a 40-plus-year-old woman, would you recommend transferring 2 embryos after a failed fresh? Yes. One question is progesterone suppositories better absorbed vaginally or orally? Well, a suppository is vaginal. But don't use anything, Dariana, that gives you allergic response. Talk to the team. Hi, Dr. Mag. Hope you had a great week so far. I sure did. Be Noble Jack, one of my favorite ladies on this internet here. Sarah, bacterial vaginosis could prevent pregnancy. Could bacterial vaginosis prevent pregnancy? There are some suggestions. I would just recommend getting it treated. It's pretty easy to get it treated. How long are consults out? Don't know that. I don't know that. I started in October with IVF. Should I use an extra donor with my AMH being so low? Really wondering what would be the percentage. Myra, I started in October with IVF. Should I use extra donor? Well, yeah, again, you're asking me a question that I'm not quite sure the framework for. What do you recommend for low motility? Avoid alcohol, tobacco, street drugs, hot tubs. Take Vital. Take the Mega Man vitamins or take the vitamins that are on the website. You can actually have a prescription for Clomid, may help with that. Out of curiosity, is having get a donor mean that my partner's sperm won't be used for the egg? No. A donor egg is fertilized fertilizing by your partner's sperm. Kristen, okay. Do you recommend using ERA for a first frozen embryo transfer? Not necessarily. I tend to use them for if you have only one chromosomally normal embryo. Yeah. Yeah, low-dose naltrexone. Sorry, Tam Curry, I'm not the person to talk to. Dr. Kiltz, and he has it on Sundays, so talk to Dr. Kiltz about low-dose naltrexone, okay? He's the expert on that. Do you recommend using... Oh, I already said that already. I was told that I could take progesterone suppository since it irritates me, but is it better vaginally? You know, I don't... I think we had a misunderstanding there. I think you're taking progesterone that can be taken either vaginally or orally. And orally is fine. Donor eggs, Myra, get around the whole age issue. So women up to age 75 can use donor eggs or donor embryos. The uterus tends not to age. So Myra, the most important thing is your uterus healthy? Can it hold a baby? Do you think E-stim acupuncture during IVF is okay? Wait, do you think E-stim during acupuncture is okay? Yes, absolutely. It's part of the Credenda Magarelli acupuncture protocol, which is the one we published 20 years ago now. Let's see, 19, that's 10, 11, 12, that's 14 years ago, but we've been working on it for 20 years. I can't wait to finally meet you face-to-face this month for our first IVF cycle. Well, come and get me. If Dr. Fink tries to take care of you, run down the hall and say, I want to talk with Dr. Magarelli. I want him to do my cycle. I don't do that. But definitely say hello. All right. Okay. What is that? Excuse me just a second here. Okay. Hi, Ranishal. All right, thanks, Be Noble. Jessica, hi. Long time no see. Oh, my God. Who else is going to get all my references for me? Great to see you, Jessica. Good. I'm glad you jumped back on. Are you in the Colorado office? Yes. And my name is Dr. Paul Magarelli, CNY Colorado. Been here for 30 years. Joined up with my dear friend, Dr. Kiltz, about a year ago. Been having fun ever since, going crazy with the wonderful patients, lots and lots of wonderful patients. So it's all been good. Takia, what add-ons do you suggest for a successful frozen embryo transfer? Well, I don't suggest add-ons. We don't do add-ons. We do protocols. The antihistamine protocol, we do the immune protocol, at least 2, depending on your history. And again, those would develop within the family of CNY, and there's a lot of tens of thousands of patients have been utilizing them. How long after your consultation does it take to start treatment? It's about 8 weeks, but that's a guess. If you have all your stuff done, it could be shorter than that. If you have none of your stuff done, it could be longer. Do you think I should wait to be financially stable before jumping into a consult? So anxious to find out what's wrong, but not at my best financially. Kayliana, a fashion, absolutely get tested. Get tested, folks. If you're out there and you want a baby, how else are you going to set priorities unless you know about your eggs, about your sperm, your uterus? Exactly. Lydia, what do you think of Neupogen replacement options out there? I don't think anything of them. It's not my area of expertise. Dr. Kiltz is certainly, that's his area of expertise, and he's written exhaustively on it. How many days should you do acupuncture after embryo transfer? Well, there's a protocol, Stella Licious. There's definitely a protocol. And that protocol is based on all of the studies that Dr. Credenda and I, Dr. Credenda, of course, is from East Winds Acupuncture. And that's her facility. And she works with us very closely. And so all of the stuff regarding the acupuncture we do is based on decades of research. At what level do you want estrogen and progesterone to be for transfer? I don't have a specific. You just have to take the estrogen as directed, and the progesterone, we want it at least be over 10. 20 is better. Do you think if I'm 40, do I have a low chance of success if I do in vitro? This is GS Candy 69. Well, in reality, you have a good chance. As I tell my patients, your chance is either 0 or 100%. You don't have a 5% or 10%. If we find an egg that makes an embryo and that embryo is normal, you're as successful at 40 as you were at 14. So it's finding that may take a little bit longer. So that's really the big deal. Can having low vitamin D cause implantation failure? Let me do it a different way, Luna. Low vitamin D is associated with lower pregnancy rates. So make sure you're taking about 5,000 international units, or maybe million international units of vitamin D. I think it's international units, because it's very hard to replete your vitamin D. Most of my patients have low vitamin D. Molly, how is CNY able to do so much more affordable, be so much more affordable? How could we do that? Well, I think it's a choice like anything else. We try harder, you know. It's a philosophical belief system that Dr. Kiltz and I have shared for 20, 30 years. It can be done by any IVF center, anywhere. There's no fundamental reason why the prices are what they are for 30 years. There's no fundamental reason. But no, any practice can do what we do. What does a high FSH over 10 mean? Well, it means your ovarian reserve is lower than the most fertile, which is less than 7. So if your FSH on day 3 is less than 7, then that portends for a very good IVF cycle or a very good chance of pregnancy. If it's between 7 and 10, your FSH, then it's a little concerning. Over 10, it's more concerning. And over 14, very concerning. So we use it as a marker, Melissa. It just helps us better understand how to treat you. In other words, how much medicine you're going to need. It tells us what to expect in terms of your fertility. Cole's baby journey. Would you change protocol after a failed FET of a mosaic embryo, or just try again after another retrieval with a PGT normal embryo? Thanks for the kisses. Yeah, thank you, B. Noble Jack. Yeah, I mean, this was just a choice that Dr. Kilson and I made decades ago that this was what we wanted. So, yeah. Would you change your protocol? Cole's baby's journey. When you transfer a mosaic embryo, you're transferring an embryo that is on the surface abnormal, but could be normal. So therefore, the chances are at least half, if not much less than half, they would be if it was a normal embryo. So yes, what you're saying is, was the failure of implantation due to the mosaic embryo or to the protocol? Likely the mosaic embryo. How would monitoring work if you're out of state? Well, we find it's easy. We have a whole team. If you go to the, and Jessica can probably get this really quickly, you go to the team outreach team on our CNY fertility website. It says, I think, outreach or partner programs, and there's a map. You click on it, and if you don't have somebody close by, the easiest thing is to ask your OBGYN if they'll help. We work with everyone. That's the big key to making us successful, is we work with everybody. How soon after discontinuing breastfeeding can you do the preconception lab work? I would wait a month after you've completely weaned and no secretions. Leah, do you think Lupron or Alyssa are necessary after endometriosis excision surgery? Yeah, I kind of do. I kind of more and more do. I think that inflammatory process, which is like a weed in a garden of endometriosis and inflammation, has a negative effect on pregnancy outcomes. I do. Are you guys over here on Facebook still alive? I'm not seeing any questions there. Give me a sign you guys are alive there. It's not moving. I hope you guys are still there. Hello. I'll say hi. Nope, it worked. It worked. Okay, good. Why is progesterone used for priming before IVF? Progesterone isn't used for priming. It's probably being used to time your cycle. The prime that we talk about is estradiol and growth hormone. That's what we use. What cycle day does the medicated FET most commonly fall on? Hope you're back. Is anybody there? It says my signals are very poor, and I don't know why that is. It looks like we're back here. First cycle, 6 follicles, no eggs. Double Avidril. What should I do next? JM. 6 follicles, no eggs. Double Avidril. What should I do next? Growth hormone. Add growth hormone. Do I record these lives? Yes, all of these lives. Add to the stream. And then let me end. Okay, here I am. Hi. Okay, somebody say hi to me on the Facebook and just post it to the chat to come over to Instagram due to technical difficulties. Yeah, hey, okay, it's back. Hi, everybody. Sorry about that. Oh, yes, we are here. Good, I don't want to feel lonely. All right, thank you, Jessica. Thank you, everybody. Thank you for saying hi again. Welcome back. So, what would cause 3 miscarriages to happen at exactly 6 weeks? Check the genetics of your husband and check your genetics. Facebook screen went white. Now we're back. How long will I take Prograf? They prescribed it to me at my retrieval. Ashley, again, that's something you want to look at the protocol and talk to the patients. Yay, I'm back. Does letrozole and Alyssa for only 1 month help before FET? Yes. Yes, it does help, Alyssa. Hi, Alyssa. The number of tabs open on my phone. You're back. The number of tabs open on my phone. I'm not sure. I'm 5 weeks pregnant thanks to you in the Colorado office. Thank you, Kayla. Is it normal to need a schedule on ultrasound for this week? My OB won't do it until at least closer to 7 weeks. Yeah, you can, and certainly you can do it with one of our programs. Or you can tell your OB, I'm happy to pay for it out of my pocket. They may be worried about your insurance program. Can DHEA be harmful? J.M. Rope. Well, there's some controversy about it. It's an over-the-counter nutraceutical. And again, nobody's going to tell you it's good for pregnancies. There are some studies that say that increases the likelihood of getting eggs in older women because of androgen deficiency, because DHEA is an androgen. So, yeah. Should I stop any or all supplements before having my hysteroscopy done? Not the supplements, Shelley. Louise Collins, can my partner's sample be frozen in Georgia and sent to Albany? Very likely so, as long as it's a certified place to do frozen sperm. Does endometriosis influence the quality of eggs? Yeah, baby. That's a great question, because next week and 2 weeks from next week, I'm talking about the role of endometriosis on the quality of eggs and treatments, etc. So the answer is yes. Hey, Mag, does it matter if one ovary, my left has, and the right has a bunch of 4s in the middle of stimming? No, they're just not exactly perfect. We're not perfectly symmetrical right side, left side. So no, that shouldn't have any effect. Now, B Noble Jack, can I take my priming supplements? Tell me what those are. Shannon, after 2 early miscarriages with normal embryos, what protocol should be added for success? Acupuncture? Are these chromosomally normal embryos? I would imagine. Do an ERA, an endometrial receptivity assay. Okay. Can my partner say, should I stop? No, I did that. Yep. How do you know whether to do fresh or frozen, Myra? Well, with donor eggs, we typically do frozen embryo transfers. They're very hardy and they're very successful. So yeah, that's what I would look at. Caitlin had 2 failed. I'm taking some time for testing, doing lap and ERP, thinking of asking my local RE to check THFR, do a repeat loss panel. My mom has immune globulin issues, which she uses IVIG to control. And so thinking I should check that. Anything else you could think of as a test? I'm 35 and AMH at 1.1. We have 5 3-day frozen, have 2 natural pregnancies 16 years ago. And lots of losses. Well, Caitlin, that's an enormous history. And of course, I know you well. Yeah, I wouldn't pretend to be able to give you a clear answer just by quickly looking at this. If you want to set up a consult, please do. Could a mass on my uterus cause me not to get pregnant? Yes. I've done fine rounds of Clomid with ovulation induction and have open tubes. Yes. If you have a fibroid that's in the inside, in submucosal, yes, it can. Want to decrease inflammation by my FT, but it's a month away. What can I do to not shock my body? Well, the main thing on SoCal to NorCal Girl is reduce inflammation by reducing carbohydrates, grains, reducing dairy in your diet. Above the ground, green, crunchy vegetables are excellent. Meats, good grass-fed meats if you can. Priming meds, Serovital, all of those you can take with your stim meds. Be Noble Jack. How far out are your consults? I'd like to have one with you, Lisa. Honestly, I don't know. But the main thing, everybody, is beyond the cancellation list, because the moment we have a gap in our schedule, we call up the global travel or the calling center, and they'll fill in. And I'll tell you, I've had people jump 3, 4, 5 months ahead. So definitely put yourselves on the cancellation list. All right. What do you recommend in order to improve the quality of eggs? Everybody wants to improve the quality of eggs. It's lifestyle. Alcohol, tobacco, street drugs, hot tubs for men, bad. It's foods, low carb, moderate protein, high fats foods. It's alternative medicine, acupuncture, meditation, yoga, choosing a stress-free life. Reducing, you can't have a stress-free life, reducing the stresses in your life. Can you do estrogen priming and testosterone priming at the same time? My doctor said one or the other. Kelly Lamb, why would you add, if your doctor said one or the other, I'm not quite sure what my answer would be. Yeah, I'm not even sure what testosterone priming is, to be honest with you. I'm going through my first cycle. Is cramping common? My first, Queen Smith. If you mean during the stimulation phase, you're getting cramping, yes. Bree, your best. Yes, you betcha. Now, if I'm looking at you there, Bree, in your picture, is that 1, 2 babies you got there with your husband? Good for you. Yeah, that's just the follicles growing larger, Queen. Just the follicles. Vanessa, thank you for reminding us. Facebook, we have our own CNY fertility group. Yes, Caitlin, let me look at it more carefully for you. Oh, how fantastic. Bree, your best. 1 baby, 1 adopted. Good for you. Good for you. All righty. Why do people ask to be on the video? I find that odd. Maybe you guys know. Can you say an example of a protocol for low AMH? Yes, the mini IVF, which is 200 international units of Gonal-F or Follistim, and then it's 20 units of HCG-LH. It's 10 milligrams of letrozole, and it's 10,000 units of HCG. The opposite of that is 450 units of Gonal-F or Follistim, 150 to 250 or 275 units of Menopur. So that's a high conventional versus a mini. Love to get pregnant one more time, but IVF is our only option. Oh, that's a good idea. Okay. Does the PGT test consist of PGT-A and M? There's 3 types of PGT-A test, PGT testing. Pre-implantation testing for aneuploidy is PGT-A. PGT-M is for monosomies or gene defects. PGT-SR is for structural rearrangements. They're very different costs. Thanks, Jessica. So the join button is in a weird spot. Okay, well, okay, as long as that's okay. Who should do a 5-day transfer versus a 3-day transfer? The only Dave Foot. The only Dava Foot. Dava Foot. I don't know. Who should do a 5-day transfer? Those people who have 4 more embryos on day 3 should do a 5-day transfer to allow the body and evolution and development to show itself before we put the embryo in. There's probably a 15% difference in picking 15 to 20% more likely to pick an embryo that's going to stick if you grow it to day 5, 6, or 7. Okay. Michael, thanks for you and your team. We are doing this week. It's totally normal to feel that my ovaries are going to explode day 6 priming. Yeah, some people really feel their ovaries as they grow. They really feel them. So, and others don't feel anything. So it just depends on who you are. What would qualify you for mini IVF? Well, usually over 40, very low AMH, failed at the other treatment cycles, or in a basic conventional IVF, you get 1 or 2 embryos every week, every time. You'll probably still get 1 or 2 embryos with the mini. So those are the kind of folks who are best geared towards the mini. How long after retrieval should I keep on taking Serovital? That's a great question. Certainly, it could help with in maintaining your growth hormone. Many people take it just simply to elevate their growth hormones throughout their lives for skin, muscle, vigor, a lot of reasons. Does CNY offer genetic carrier testing? Is it worth it, considering getting it done for my husband and I? Yes, do the carrier testing. Absolutely. Everyone should do carrier testing. It's a unique opportunity to find out if there are gene issues that may interfere with you or your children's future. Yes. Binoba Jack, I read an article that the chance of 1 embryo splitting into 2 is higher with IVF. Yes. In other words, identical twins. Is that true if there are no twins on the female side? Yes. It has nothing to do with your history. We believe it has to do with the actual protocol, or I should say, the process of embryogenesis in a laboratory. We think it may be the medial environment, the use of ICSI, the use of assisted hatching, the use of PGT biopsy. All of these have been hypothesized to increase the chance of identical twins. Mara San Antonio, I just had a retrieval, got 6 eggs, 5 fertilized, and only 1 mated. I have a 6-day 3cc embryo getting ready for transfer. Should I go ahead with a transfer, do another retrieval? Well, Mara, it depends on how many children you want, depends on your age. I sure would. I didn't hear what you said about doing fresh or frozen when doing IVF. If you have many embryos, then grow the embryos to day 5. If you have few embryos, grow the embryos to day 3 and transfer on day 3. Okay. If we have normal spermiogram, okay, would Clomid make sperm even better? Sarah, not likely. Not likely. I like that spermiogram. I usually call it a semen analysis, but I like that spermiogram. All right, I think we're getting you guys tired. Not a lot of questions, or maybe it's my internet. It could be my internet. No questions. There we go. Can I do a fresh transfer and have the remaining embryos PGT tested? Yes, you can. I don't recommend it. The principle behind doing PGTA is to eliminate miscarriages and to eliminate the transfer of abnormal embryos. So why would you risk an abnormal embryo or a failed transfer by doing a fresh? I think people think it saves them time, but it doesn't necessarily save them heartache or anything else. So I'm also seeing a lot of folks coming in they want to do IVF with PGTA, but they have an embryo from a prior cycle, so they want to switch hit the embryo from the prior cycle in the same cycle as the new cycle that are making more PGTA. Again, putting that mishmash together, I don't see an advantage in that. I think you think it's an advantage because you're saving time, but you're not really looking at the big picture, which is what's going to get me a baby. So if you're doing fresh, do fresh. If you're doing frozen, do frozen. Yeah, I wouldn't mishmash them around. Is an inositol recommended to take, Yandra? Yes. What would you recommend for irregular periods? Well, if it's just for irregular periods and you want to get pregnant, letrozole is a really good thing to do. Is ICSI for frozen embryo transfer? No, ICSI is putting the sperm inside the egg queen, and frozen embryo transfer is frozen embryo transfer. Diagnosis with a defect in 1-2, perimenopausal, 1 failed IVF cycle, and 2 natural births 20 years and 12 years ago anyway. Can you possibly get pregnant? Yes, you can, Nicole. I had my consult and did my blood work. I'm vitamin D deficient. I'm taking vitamin D now. How long should I wait to start my stims? Give it at least 1 cycle. KEDOX, KEDXO. Is 6 rounds of Clomid unsafe to take? Yes. After 3 rounds of, not unsafe, after 3 rounds of Clomid, you need to take at least a month, if not 2 months break, before you do another 3 rounds, and then you're done for life. If you're not getting pregnant after 6 cycles of Clomid or letrozole, move on to IVF. Brandon, are the sperm tests accurate if done at home? They're only telling you that Elvis is in the building. It's basically saying sperm are there, but it's not telling you anything functional. If you're already using human growth hormone, can you add Serovital? Yes. Arath, does CNY do ICSI for all eggs? Yes, unless you tell us not to, which I don't understand. What if all my embryos came back abnormal after the first retrieval? You don't recommend doing a fresh and test the rest? No. I'm not sure the advantage there, Christy. Happy to say my daughter is finally expecting 19 weeks, but ended up using donor embryos, but we are thrilled after our 3-year journey. Thank you, CNY. You're very welcome, Lori. Any thoughts on ovarian PRP with good AMH? Nope, I wouldn't do it. Oh, 43? Yeah. That's a relative thing. Yeah, I think it's not unreasonable after 40 to consider PRP, but again, it depends on how many eggs you get. Have you seen a slow beta pick up after the 3rd beta? No, I have not. And if it does pick up, it usually is behind, which may suggest that the HCG is associated with the nectopic pregnancy, so be careful. And sometimes, though, the beta can be low because you had twins and then it becomes 1. So it's too hard to answer, Stella Licious. All righty. Is it high risk to transfer 2 embryos at a time? Yes. How many embryos can we transfer? 1. That's what the American Society for Reproductive Medicine recommends. For an IVF cycle, can we choose to freeze some eggs and fertilize? No. Freeze some eggs and fertilize some, yes. But you have to plan ahead for that. Is there a recommendation, Sunset, for a protocol to thicken the uterine lining? What's the optimal thickness is 10 millimeters, but anything above 6 and below and up to 17, 18 are fine. Getting 10 eggs at retrieval, all mature, but a few blasts and abnormal. Would PRP help? 10 eggs, that's a good number. I forget how old you are, but that's a good number. It might, because it's really a growth factor. Andrea, how many months can you use human growth hormone? As long as you want. The same thing with Serovital. Will a diagnosis of recurrent pregnancy loss make future pregnancies high risk? It's not the diagnosis that makes it high risk. It's that you have that syndrome that makes it high risk. Thanks for the kiss. Okay, bye, B Noble. What are your chances of getting pregnant with 1 egg? Well, it depends on how old you are, Nanny. Christy, I'm confused. Test or not test? 41-year-old AMH of 2.5. Well, somebody, what should I do the next round? Christy, is a day 3 transfer? Don't test. That's what I would do the next time. Reason not to test, acupuncturist said, why test? Tests aren't 100%, and what if the next round comes back abnormal? Okay, let me tell you about the PGT testing, and I know it's a little controversial, But if your test says they're abnormal, you have a 99% chance that they are. If your test says that your embryos are normal, you only have a 60% chance that they're normal. So it's a really good test, PGT, to find abnormals, but not the best test to find normals. $43, 10 eggs at retrieval. Yeah, Lisa, you could do PRP and it can improve the quality of those eggs. Vaccine during fertility, yes. The COVID vaccine, studies are coming out left and right about the safety and efficacy of having the COVID vaccine during your time trying to get pregnant, if you're breastfeeding, if you're pregnant. Yes, the vaccine, as a matter of fact, they're saying it's giving some immunity for the baby through the breast milk. Yes, if you get a COVID when you're pregnant, there's a likelihood that it's going to influence your pregnancy negatively. So the COVID vaccine, like all of the vaccines that all of you gotten growing up, hepatitis A, B, C, smallpox, polio, mumps, rubella, the MMR vaccine, varicella zoster vaccines, all of these vaccines, we're not really associated with the politics. Now, the key thing about the COVID is that it is proven to be harmful to pregnant women, proven to be harmful to sperm. So why risk getting an infection? But now, when you do get the vaccine, we just ask you to not take the immune protocols because that's counter to your vaccine for that 1 month. But yes, vaccine, yes. Okay. What are your chances of getting pregnant with one egg at 28 years old? About 20, 25%. One embryo, I'm assuming you mean. I have endometriosis stage 4 and just had my third laparoscopy 1 month ago prior to FET scheduled to end of September. Do I need to take Lupron or Oralisa? You certainly should. You certainly should. Does PGTA help to prevent Down syndrome? PGTA will allow you to eliminate Down syndrome. That's one of its strengths, is it can find an abnormal embryo and you don't have to put it in, and therefore you eliminate Down syndrome. Can we transfer two if we want? I know some doctors allow it. You're asking the wrong doctor. I believe that the American Society for Reproductive Medicine set those guidelines to allow us to get insurance coverage for fertility, which we finally did in Colorado after 14, 20 years of trying. Brittany, have you ever had IVF transfers fail due to anatomical structure issues? We think that's true with the uterus or cervix, yes. If you're not able to get it speculative through the end of the cervix uterus to transfer, if so, what should be the next step to determine what to do? Okay, got it. So cervical stenosis means you can't get into and through the cervix. And actually, we just found out that a company came up with a very interesting balloon to fix that. So that's one option. The other is to do serial cervical dilation months prior to your procedure, because yes, you want to make sure you can get the embryo in there. What procedures does the Atlanta CNY location offer? Ultrasound and IUIs. Tricia, my husband had a vasectomy. We want to do IVF with teaser Pisa. What's the success rate on the first try? It's depending on your age, Tricia. Katie, I just had a failed IVF, sorry, at a different place. I have PCOS and was put on metformin. They got 13 eggs, but none were mature, but they triggered me at 16. What did we do differently, Katie? Well, grow to at least 18, if not 20 millimeters. That would be the first thing that I would do. 34 and 1 block tube and PCOS. Should I go straight to IVF? Yes. How many units of ACG do you recommend for priming? 6. Can I get SIS and HSG after day 3? Yeah, you do it on day 7. Do I need to redo my labs after 2 years? Yes. Can you get SIS and HSG after day 12? No. like day 14 of my cycle. You should not, unless your tubes, unless, I don't know, there's no unless. You really shouldn't, because you could be pregnant. Heather, I'm 43. Should I do embryo testing or take my chances? Well, the data says don't do embryo testing. Take your chances. That's what the data show. But you have to make that decision. You have to make that decision. Okay, we're running out of time here. Looks like we got about 4 minutes. Next week is part 2+ of our endometriosis discussion. We'll be starting at 4 o'clock as we have. And I really appreciate you guys starting at 4. So that's something we'll do next week. Katie, repeat my chance. I don't know, Katie, what the question is. So under what circumstances would you recommend ovarian PRP? Certainly with those with low ovarian reserve. Thank you for the kisses. Thank you for the kisses on my Instagram. You guys are great. Is it good to do IVF at 45? It's not good or bad. If it's what you want to do, we'll help you. If I have irregular cycles and low ovarian reserve, should I track ovulation in the home tests? No. What are your thoughts on Clomid and HCG injections for helping sperm count? It does. Have you ever had a patient who brought DE and ended up without any good embryos? Who bought DE? Don't know what a donor embryo? A donor egg, got it. And ended up without, yes, of course, because donors are humans too. All righty. Where are we? Okay, so I think I'm going to sign off, guys. I really appreciate you. This is Dr. Magarelli from CNY, Colorado. I am so thoughtful. Yeah, thanks, Social to NorCal. It's hard to answer all the questions. So anyway, good luck this week. Think pregnant thoughts. It's all about belief. You talk to my good friend Robert. And I want to thank my team. Shout out to everybody in my team. Thanks for the lovely kisses. And you'll see me next week. I'm a little bit losing my voice, so I think I'm going to sign off. But thanks for being here, guys. You guys have a great day, and appreciate you guys. Bye, everybody. Let's see where we are here.